Hey everyone, Alex here. Today we're bringing the First Year Family our very first podcast on the topic of supervision. I have the privilege of interviewing Dr. Kate Campbell, owner of Bayview Therapeutic Services, her private practice in East Fort Lauderdale. Kate is also a double LMFT approved supervisor and qualified supervisor for the state of Florida. I was also fortunate enough to have Kate as my supervisor for licensure. Hi, Kate. Welcome.
Thank you. Woohoo! I'm so excited to be here. It's so interesting to be on the flip side because usually I'm the one interviewing people to be on my podcast at the private practice startup.
Yeah, this is awesome to be on this side of it too.
Yes.
So today we'll be talking about the benefits of supervision from a supervisor's perspective. Before we get started, can you tell us a little bit about your supervisory experience and when you started supervising interns for licensure?
Yes. When I first graduated with my master's, and then I went on to get my PhD, but after I graduated with my master's, I was all ambitious and ready to dive into the field and make a difference in people's lives. And when I started working in an agency setting, I was kind of shocked because the agency, the culture and everybody who worked there they were overworked, underpaid, and like burnout. And here I was like all excited. And so the supervision experience that I had there was not meeting my needs. And so I quickly learned that I needed to go elsewhere and seek my licensure supervision off-site. And I had a professor when I was in the master's program, Dr. Annalyn Schooley, who I always liked her teaching style, and she was just so knowledgeable and approachable and felt very comfortable with her, and I knew that I would grow a lot in working with her. And so I actually, just maybe a month or two after I started working at this agency setting, I transitioned and went into supervision with her, and I loved it. She was so great as a supervisor, and I still call her, over 10 years later about questions that I have, or if something's in a gray area, or I just need some feedback on something. So it's kind of like once your supervisor, always a supervisor. So she's really been a big influence on my life and mentor and everything like that. And through my experience of working with her, I was inspired so much so that I wanted to become a supervisor myself. And so when I graduated supervision with her, got my license, I actually went on to continue with her and got supervision of supervision to become a double LMFT approved supervisor. And during that time, I was working in an intensive outpatient program that was privately owned, and a colleague and mine, we actually started an intern program there, and we were working with master's level interns from Nova Southeastern University and some surrounding colleges while they were getting their internship hours. And so we did that for several years, and it was such a fun experience. I loved it so much. And then when I launched into private practice full-time in 2011, I actually opened up a supervision practice as well. And then I have a second business called the Private Practice Startup, which I referred to earlier. We have podcasts and we support private practitioners from startup to mastery. And my business partner, Katie Lemieux, and we actually teach the Florida Qualified Supervisor course several times across the state of Florida. And that's something that we really love to do. We actually have a training coming up next month, September 15th and 16th, actually. So that'll be really cool. Yeah, so that's a little bit about my experience and what kind of inspired me to become a supervisor.
Yeah, absolutely. I didn't know some of that stuff, actually. So that's cool that I just learned a little bit about you. But it does sound like you have a ton of experience as an approved supervisor. So we really appreciate you being here. And we're excited to kind of follow up with these questions. So let's jump right in. The first thing we're curious about learning is about the importance of a successful supervisory relationship. From your experience, what defines a successful supervisory relationship?
Gosh, I kind of think of this very similar to common factors research. And I know I talked about that, in your supervision experience working with me. And when any client is going to see a therapist, the second most influential factor in the client's successful outcome is actually the therapeutic relationship. And I really see it so similar to the supervision experience, where the relationship that you have with your supervisor and the safety, the acceptance, the respect that's there, the collaboration that's there, all of those things are just so influential in a supervisory's, I guess I'd say a registered intern's successful experience, because You really need to build that rapport with them, create that safe and non-judgmental environment, and really meet them where they're at and have compassion and encouragement, because it's not always easy being a registered intern.
No, it's not.
So that's about creating an atmosphere and a relationship that really fosters successful outcomes. But then there's also the piece of the supervisee or registered intern. They really need to have a certain level of commitment. They need to be willing to step outside of their comfort zone with trying new skills, and really need to be open to collaboration. They need to be authentic and honest about what they're going through, both personally and professionally, and then be open to that encouragement and nurturing from their supervisor to kind of amplify their strengths and strengthen areas that need to be strengthened in their work together.
Yeah, absolutely. So that kind of leads me into my next question, which you started to kind of answer already. But do you feel that there are factors that jeopardize the success of that relationship?
I would say definitely. You know, if someone is not really committed or don't really see this as a priority, maybe they, cancel last minute or reschedule or kind of flake out, or they're not doing homework or things to help themselves grow and evolve in the supervision, obviously that would be a detriment. And then, we all have things in our personal lives, and sometimes personal issues or issues of the past that have been unaddressed can come up and get in the way of your growth. And if you're not willing to deal with those things, then that can certainly get in the way, both personally and professionally. And that's an aspect of the supervisory relationship. I focus a lot on self of the therapist work and helping people to address both the personal and the professional side, because they are so intertwined. And then for novice clinicians, as they're just starting out and figuring their way, through the field, they are really at risk for compassion fatigue and burnout, and they really need to prioritize self-care. So if someone is not really taking good care of themselves, then that would be a detriment. And then also sometimes the treatment facilities that are here located in South Florida, or agency settings, or, any type of workplace, sometimes people engage in unethical behavior. And so just being very careful about the kind of work environment that you're in, and that you're setting yourself up for success, and that you have a really great supervisor to kind of walk you through and support you through your whole experience. It's a journey.
Absolutely. So similar to what you were sharing with us before, it seems like you feel a successful supervisory relationship really takes work on part of the supervisee. Similar to therapy, if you're going to be committed to that process, it really takes work. And so that has a huge impact on, the course of supervision.
Absolutely. Just like, supervision is very different from therapy. It can be experienced as therapeutic sometimes when you're doing some of that self of the therapist work, but it's very different. But in the same way that you would help your clients identify goals and help them work towards those goals, you're doing that as a supervisor. Now, as a supervisor, we also have an obligation to make sure that our registered interns are meeting the standards, the ethics, the legalities, the laws, the rules, and really meeting the competencies of being a competent clinician. So there's a little bit more of an invested aspect there, but it is very similar in terms of setting those goals and helping them build on their strengths and strengthen areas that they need to strengthen. Absolutely.
In your experience and all your years of doing this, what have you found to be the biggest struggle for interns? Is there something that you see commonality, or, I know you were mentioning burnout and compassion fatigue before.
Yeah, I experienced this. I've seen it happen with so many of my interns and just many of the people that I mentor and coach and supervise over the past decade. Just dealing with the reality of what it's actually like in the field, because people are graduating, and I think there needs to be a lot more time spent in the master's programs really preparing people for that transition and all of the challenges that they're going to face. Many of the work environments that people are going to be in, they have high or even unrealistic expectations of the interns, and that can lead them to being overworked and underpaid and sometimes taken advantage of. So being very, very prepared for that, having a good support system to help guide you through that, being able to set boundaries when you need to, and then also working within environments that are maybe more medical model focused or pathological. It can be really hard to maintain that connection to the systemic philosophies and theories that you learn about in school, and trying to continue to keep that alive and fresh because the dominant discourse is really that our field is saturated with a lot of medical model type working environments, especially for interns who are starting out and getting their hours.
Yeah, absolutely.
Yeah, so that's where supervision can be so helpful in keeping you fresh with the theories, with the philosophies, and staying true to your roots, while also being able to collaborate and work with providers who have different perspectives, and you can speak that language, you can hold that as one view of looking at things, while also being able to look at things in a bunch of other directions as well.
Yeah, absolutely. And I think what you brought up about dealing with the reality and being prepared for what it's really like out there was a huge motivator for Brittany and I to start the first year, because we have firsthand experience, and you as my supervisor know how challenging it was for me at times, and supervision kept me really grounded. So that's another reason we're super excited to be interviewing you, because, you know, we want our interns to be prepared.
It's really amazing what you guys are doing. I'm so supportive and so excited to see as this program is developing, because there is such a need.
Yeah, absolutely.
Absolutely.
So something that we've discussed a lot with our, you know, the people in our group, as well as a lot of interns that we've, you know, interviewed just to kind of get a reality of what people are dealing with right now, is there's this struggle of when to hire an outside supervisor, because a lot of times your job has on-site supervision that counts for licensure. So we really wanted to pick your brain about when you would say it's important to hire an outside supervisor, even if you're receiving, you know, the free on-site supervision.
That's a great question. You know, in my opinion, it's always good to seek outside supervision, regardless if your workplace provides supervision or not. But definitely if your supervision isn't focused on your needs or helping you grow as a professional. I hear stories so often about people, quote unquote, getting supervision, but it's really all about admin stuff, like auditing charts and stuff like that, and you're not able to talk about the things that you're struggling with your clients, or look at caseloads from different perspectives, or applying models, or those types of things. So it's really important to make sure that you're getting your needs met by the supervision that you're getting. And if you don't feel heard by your supervisor, or you feel like they're not meeting your needs, there's nothing wrong with saying, you know what, I'm going to step outside to get trained in a different perspective, or I really want to see the supervisor because they, you know, they're experts with a particular model or presenting problem that you want to gain more experience with. And everything's up for negotiation. So you may find that your agency is actually willing to pay for supervision off-site. So, yeah, that's
interesting. I didn't know that.
Those are interesting things to consider. And then,
absolutely,
especially if you consider that there's any sort of unethical or fraudulent activity happening, then you definitely need to seek supervision elsewhere. I can't tell you how many times that someone's come to start with me for supervision, and we get through our initial session and identify the goals and go over the paperwork and all of that, and they say, you know what, let me ask you a quick question, because there's like some gray area stuff that I don't know, it's not sitting well with me, and then they drop a bomb on me about this fraudulent or unethical things that they're being asked to do or that they're seeing. And so you just kind of have to be careful out there, and that's why it's good to have somebody off-site who can really guide you through that stuff.
Absolutely, and where it's safe to talk about it.
Exactly.
You know, we address in our supervision newsletter about, you know, that exact dilemma. What do you do when you're seeing these things happening around you and there's not someone safe or that you can really trust at your workplace to talk about these things? So we stress the importance of having that safe outside supervisor to really process anything that's going on.
For sure.
So speaking of hiring the outside supervisor, another thing that we are talking about in our newsletter this month is, you know, how to interview your supervisor. We hear a lot about interns feeling like they need to be a good fit for the supervisor, which is true, but it's a two-way street. So what would you say are important things for interns to consider when they're hiring?
That's also a really great question. Yeah, it's so important to have that fit be in a good place both ways.
Yeah.
And what I would stress is don't focus on the price first. Some people just price shop, and they'll call supervisors and they'll say, what do you charge? And that's pretty much all that they ask. They want to go with the most affordable supervisor, and I get it. Price is definitely a factor. It's a 2-year long relationship, and you want to consider that. But I would say focus more on the experience that you will have with them, and ask them about how they can help you expand your skill set. Be clear on what you want to gain from supervision, whether it's more competence or confidence in certain models or specializations or treatment populations that you're working with. You want to interview your supervisor, ask them how they're going to help you grow both personally and professionally. Ask them about what model of supervision they work from, and are they currently seeing clients? Are they, if they are seeing clients, what models are they trained in, and how would they describe their approach? Also, are they experienced in the areas that you want to work in? And then asking them how they would meet your needs, sharing with them the model of therapy that you use, talking about schedules, logistics, asking them what are they most passionate about, and then talking about price, of course. So you want to really get that whole picture and interview them on all of those different aspects.
Yeah, those are all really great suggestions. I love that. So lastly, this is kind of a broad question, but I'm sure you have a great answer for us. What is it that you feel our listeners really need to know about the value of supervision?
Yeah. I mean, it is such an invaluable resource, especially for novice clinicians, to really set them up for long-term success. With my supervisees, I really try and support them with their current growth in the areas that they want to focus on in our work together, but I also work to set them up for long-term growth as well, and really think about, okay, so what are your visions after supervision? What are your visions for the future? What areas do you see yourself going into, whether it's private practice or starting a program or different things like that. And then once you're finished with supervision, really making sure that you continue the supervision experience through peer supervision or more informal, spontaneous type of supervision, so that you can always bounce your ideas off of other people. And, we need to support each other in this field, and seeing clients can be isolative at times. If you got a really busy schedule, or maybe you're in private practice, whatever type of setting you're in, it can be isolative. So it's really important to stay connected so that you can keep the theories fresh, you can stay connected to the field, you can really make sure that you're doing the best possible work that you can. And then on the flip side, there's also a lot of value to the process of supervision for the supervisor as well. It's a mutually beneficial relationship for sure. Just as much as the intern grows from the supervisory experience, the supervisor grows from them as well, which is really cool. And so there's that reciprocal growth happening, and it's really rewarding to work with interns, and it's a way of making a greater impact in the world, because you're able to help your interns grow and then help them help their clients grow as well. So it's like you put those tree branches further and further out, which is really cool. And it's great for networking, and it's obviously an additional revenue stream as well. So I just wanted to speak to the value on both sides of things there.
Absolutely. And I love what you said earlier about it being like a lifelong relationship. That's definitely something I feel like I have with you, and why that from the beginning, that supervisory relationship and connection is so important. So I love the tips that you gave our listeners about really being attentive to that and looking at the big picture of things.
Absolutely. Well, thank you so much for having me on today. I really appreciate it. It's been so much fun.
Yeah, I'm sure our listeners will find a lot of value in what you've shared, and Brittany and I really appreciate you taking the time to do this interview with us.
Of course. Well, best of luck to you guys. And if anybody wants to get in contact with me, they can certainly visit my website, bayviewtherapy.com, or they can give me a call at 954-391-5305 extension 1. But I'm sure you'll have that information wherever you post this podcast interview.
Yep, it'll be on our news. It'll be on our newsletter, so they can check all that out there.
Okay, awesome. Yeah, and for anybody interested in getting into private practice as well, because I know that's an option, we also have some amazing resources through the privatepracticestartup.com. So make sure to check those out for our free podcast and trainings
definitely
and
check
events.
them out. That has been a great resource for me as, a therapist starting out in private practice. So for our listeners out there, Kate has a lot to offer with her supervision as well as her private practice startup. And we hope that you find value in what we've shared today. So thank you.
Thank you for being here.
This has been Alex for the First Year Podcast series. We have a super exciting lineup for our October podcast, as we're getting the inside scoop from registered interns currently working in agencies, substance abuse treatment facilities, and private practice. They are sharing their experiences about what it's really like to be an intern out in the field, and trust me, you won't want to miss it. Thanks for listening. Have a great day.